afternoon. Right now, part of our local and national conversation is about reimagining public safety. And as we take that subject on, we have to recognize that creating public safety is about much more than how we respond to acts of violence. It's also about the work we do to prevent violence from happening in the first place. That's why the work of our Office for Safe and Healthy Neighborhoods is critical to Metro government's public safety. The focus of this office is to help create a city of safe neighborhoods where everyone is secure, supported, free of violence, and prepared for lifelong success. My administration established this office in 2013 following a triple homicide months before and calls from the community to create an office specifically focused on violence prevention. Over the years, the Office for Safe and Healthy Neighborhoods, or OSHN as we call it here and around the community, has been awarded millions of dollars in competitive grants, including a $5 million 5-year federal grant to promote resilience and equity for Louisville families and young people most affected by trauma, inequity, and violence. It's critical to have this kind of effort because it helps us understand the relationship between adverse experiences, health behaviors, and health status. For example, many of our young people who are struggling in school may not need an educational intervention, but they may actually need support navigating PTSD and or mental health issues resulting from traumatic experiences like exposure to violence. And because of the impact of generations of systemic racism, the burden of violence hits our black community especially hard, and that's unacceptable. According to the CDC, homicide is the leading cause of death for African American males between the ages of 10 and 35. That fact is both heartbreaking and infuriating. And it's one reason why we need programs like the Trauma Resilient Community Initiative, managed by OSHN and funded by the U.S. Department of Health and Human Services Substance Abuse and Mental Health Services Administration, in partnership with U of L's Kent School of Social Work and 7 counties. At Metro Government, we're committed to doing all we can to prevent violence from taking lives and from making it harder for too many in our community to reach their potential, because the city should be a platform for human potential to flourish, and that's our definition of compassion. And that compassionate work has never been more important than right now as we contend with multiple crises unfolding in our city and across the country. COVID-19, the economic downturn, the calls for racial justice on behalf of Breonna Taylor and too many others. We have to meet all these challenges head on. We also have to address the horrifying increase in homicides that we're seeing in our city, many of which are connected to the illegal drug trade. We have to take action to prevent more senseless deaths. And the reality is that all of these challenges are intertwined. And part of OSHN's work is to help us understand how these challenges overlap with other long-standing issues like systemic racism, poverty, substance use, and more to produce tragic consequences. And that's why the work of OSHN is so critical and has been since its founding, because we cannot arrest our way to a solution. We have to find ways to reverse these trends. And we need dedicated and visionary leaders to do that. We need leaders who have the right skills, experience, perspective, and approach to help us establish and maintain relationships with those in our city who are directly impacted by violence, while also working closely with community partners like the University of Louisville to implement strategies that treat violence as the deadly disease that it is. I'm excited about this work and excited to announce the 2 brilliant, dedicated, and visionary leaders from right here in Louisville who are joining our team. Monique Williams is the new director for the Office for Safe and Healthy Neighborhoods. Monique has extensive experience at the University of Louisville as the program director and research manager in its Office for Public Health and as the director of its National Center of Excellence in Youth Violence Prevention. Monique, soon to be Dr. Williams, is finishing up her PhD from the U of L School of Public Health and Information Sciences this year. And she has contributed to published literature highlighting community health development, violence prevention, and racial equity. Thank you, Monique, and welcome to Metro Government. And Dr. Stephen Kelsey is OSHN's new faith-based liaison. Dr. Kelsey has a unique background as a retired Louisville Metro police officer. While serving at LMPD, he earned several awards for valor, life-saving, and Officer of the Year. Today, he's a psychologist and owner and president of the Fresh Start Educational Counseling Center and a founding senior pastor of Spirit-Filled New Life Church Ministries. Dr. Kelsey will help develop and grow a coalition of faith-based organizations and faith leaders who are aligned with the mission and vision of OSHN and working to promote peace. He will also organize responses to shootings and homicides in our city alongside other faith advocates throughout the community. Dr. Kelsey, welcome back to Louisville Metro Government. So thank you both for taking on this incredibly important and much needed work of leading our Office for Safe and Healthy Neighborhoods and working with our community partners to prevent violence and help more people in our city reach their full human potential. To tell us more about the new leaders of the OSHN team and to introduce them, I'd like to introduce our Chief of Community Building, who oversees Safe and Healthy Neighborhoods, Reverend Vincent James. VJ?
Thank you, Mayor Fisher, and I'm really excited today to be able to come here and share with you more about our leaders, new leaders in the Office for Safe and Healthy Neighborhoods. I want to start by sharing life's most persistent and urgent question is, what are you doing for others? And when we think about what are we doing for others, our new leaders, Monique Williams and Stephen Kelsey, have answered that call with a life commitment of serving others. And with this life commitment, serving others, as we are thinking about what the mayor has said, we are experiencing the confluence of 3 pandemics, or one, COVID-19, looming economic downturn, and the public cry for social and economic justice. And with these 2 leaders, they have answered the call with their commitment working in the Office for Safe and Healthy Neighborhoods. They are joining at a time when many leaders are tapping out. They are tapping in because they want to continue the fight against systemic systems that have created much of the violence that we are seeing in our communities today. And it is challenging work, but it is exciting work because they too recognize that violence is only a symptom of a much larger issue in many of our urban cities that we see. We at the Office of Safe and Healthy Neighborhoods focus our work on addressing the root causes of violence, utilizing a public health approach, and employing data-driven and evidence-based solutions. Really what our goal is to create a city of safe neighborhoods where everyone is supported and has an opportunity to reach their full human potential, absence and devoid of violence, for a lifelong success. And to do this, you have to get the right people on the right bus, in the right seat. To quote Jim Collins, and we've done that through the new director, Monique Williams, and our new faith-based liaison, Bishop Stephen Kelsey. Monique previously served as the director of the Youth Violence Prevention Research Center at the University of Louisville, where she was responsible for leading this organization and worked on groundbreaking research to address structural violence that leads to a lot of the youth violence that we see in our communities across this country. Under her leadership, they developed a youth fellowship that helped our young people to understand structural violence and to gain self-identity through the Social Justice Youth Development Framework. The Social Justice Development Framework views young people as assets and active agents in change and having the capacity to transform their communities. Stephen Kelsey is a retired Metro Louisville police officer and the pastor of the Spirit-Filled New Life Church Ministries. Stephen is the owner, also the president of Fresh Start Educational and Counseling Center, and with extensive community experience. With his experience, he'll be able to help build out a faith-based structure as it relates to reducing violence. And he's no stranger, unfortunately, to violence. As a police officer, Bishop Kelsey would often be called to homicide sites. And within those homicide sites, he would often see the young men and women lying in the streets. And he's seen this firsthand, but not only would he see it, but he would also attend the funerals as a pastor. He has unique qualifications in terms of what we're going to be doing in the Office for Safe and Healthy Neighborhoods to really realize what the potential that our young people can have, and our young people in getting work and getting to education and having access to other resources. But not only that, people and families in our community that have been devastated by violence. I'm so excited to have Monique and to have Stephen working in the Office for Safe and Healthy Neighborhoods, and to share a little bit more about themselves, and even to talk a little bit more about what their desires and goals are. We're going to have them to come and share with us. So at this time, I would like to introduce and have our new director for the Office for Safe and Healthy Neighborhoods, Monique Williams. Following Monique, we'll have Bishop Stephen Kelsey.
Good afternoon. First, I'd like to say thank you to Mayor Fisher and Chief James for the opportunity to serve our city in this new capacity. I'm excited to join a team of dedicated individuals who are committed to improving the health and well-being of our community, specifically through violence prevention efforts. As they've both mentioned, the office is really focused on helping to create a city of safe neighborhoods where everyone is supported, secure, free of violence, and has the opportunity and are prepared for lifelong success. And so that focus encompasses much more than what we traditionally know like violence or violence prevention to be, where we hone in on perpetrators and victims. And so we're talking about reimagining public safety, and a part of that has to be that we reimagine how we define, how we discuss, and how we develop interventions for violence prevention. And so from a public health perspective, we understand that when we solely focus on individuals, their behavior, and how they navigate, we miss key insight into what could give us a more holistic picture of what's actually happening. And so we get a clearer picture when we consider the connections between the individual and their health, their socioeconomic status, their education, and violence. And we get an even clearer picture when we consider the connections between the individual and things like racism, housing segregation, redlining, created concentrated poverty, and violence. Understanding how patterns of violence are connected to social systems and social customs is really key to the equation of violence prevention. And so continuing to broaden our work to include social and structural determinants of health is what will help us get to root causes of violence, because that lens is what helps us to understand why the burden of violence disproportionately falls on the systemically marginalized communities within our city. And so that'll be a huge part of some of the work that we do. And then to also to understand the notion between the individual level and community level factors. We understand in public health also that the context of people's lives determine their health, and people's choices play a huge role in that. And so blaming the individual for making choices that they have in limited capacity isn't completely accurate or helpful. And so intervening at that individual level solely isn't going to get us to what we say that we want to see as far as safe and healthy neighborhoods. And so for the last 5 years of my career, I've worked with an incredible research team at the University of Louisville's Youth Violence Prevention Research Center, where we've had a unique opportunity to hone in on just that, looking at systems level structural issues that directly relate to violence. And we've been able to bring that conversation locally and nationally as well to our network. And so I look forward to bringing that to my new team at OSHN and being able to work within this space to create new and innovative strategies for violence prevention. Thank you.
Good afternoon. Greetings to you, Mayor. Thank you for the opportunity. Chief James and Miss Monique Williams. I'm Dr. Stephen Kelsey, Bishop Stephen Kelsey. My resume has already been given, but I want to say I'm very excited about this new opportunity to serve the city of Louisville in a different capacity. When Chief James called me and he said, Bishop, I have an opportunity that I want to present to you to be able to work with your skill set. And so as he began to unfold the job description, I began to pray about it, and I said, that's something I believe I can participate with. And so he asked me, what would I envision being with the Office of Safety and Healthy Neighborhoods? I said, one thing we have to understand, not only do I bring experience, I bring with me my memory. And my memory takes me back when I rode in the 4th District in the West End, visualizing all the homicide bodies that I had to see in the streets. It was very saddened that young men with no direction, coming from families, 2-parent or single-parent family homes, uneducated, no jobs, they ended up doing drugs or robbing or stealing and getting murdered. So as an African-American male, as a pastor, as a retired police officer, I come with various levels of experience with this. And not only are we dealing with a pandemic, we're also dealing with police killings and black-on-black killing. And so when we're going to say that Black Lives Matters, we also need to say all Black Lives Matters, not just the athletes. We also need to include everybody. Because as a pastor, I'm reminded that God said, let us make man in our image and in our likeness. And sometimes I often wonder if God really likes the image and the likeness that he is seeing. And so I'm glad to be a part of this team. And as a clinician, one thing I realize when clients come to me, first of all, we have to assess them. Then once they get assessed, then we look at the diagnosis. And then together we work on a treatment plan. Because if I just give the client a treatment plan from my perspective, they might not agree to it. And so what this office is doing, it is willing to work with the community to rewrite a treatment plan where the community and the government can together come up with a treatment plan where we can work this out together. And then if we find some things that are not working, what do we do when my clients come back in? We reassess to see what worked and what did not work. And in closing, I told my church Sunday, what we're dealing with this pandemic and all these homicides and these shootings, I said, every one of us in here, in our church, we have a remote control at home. I said, Sunday, my wife, we have our beds where one can lift up, one can stay down. She said, my control's not working. And we just bought the beds. I said, well, baby, you might need to check the battery. She said, what are you talking about? She said, the batteries are in place. They might be in place, might be in position, but they might be facing the wrong direction. And so if anything's facing the wrong direction, then you're void of its power. So she took the back off and she said, oh, baby, you were right. She said, I remember dropping my remote and the battery fell out and I just placed it back any kind of way. And so therefore, we cannot do things as usual. Put people back in position and they don't have any power because they're facing the wrong direction. So I'm excited to be a part of this team, and I want to call out the real first responders that I believe that are responding. Every time I went to those homicide scenes, some pastor had to go to that family to preach that eulogy, to give comfort to a family, to make sense out of nonsense. So what I envision is bringing all the pastors together, sitting down with those who got boots on the ground, get these young men who are homeless, are in gangs, and bring them together. Let us sit. Let's talk. Let's have a real forum. We just cannot just have a treatment plan and say this is your treatment. But in order for this to be effective, the government has to work with the people, and the people have to work with the government. Thank you.
Thank you, Dr. Kelsey. Thank you, soon to be Dr. Monique Williams. All right, with that, we're happy to take any questions here on this exciting day for OSHN.
I'd like to remind reporters to please place your questions in the chat feature addressed to everyone. Okay, we're not seeing any questions in the chat. Okay, the first question is from Stephanie Wolf with WFPL. She asks, Mayor, what is your response to the ruling from Judge today that Chief Schroeder and Chief Hess must testify in open session as part of the Metro Council investigation into your administration? And do you plan to appeal?
I know that came out just as I was walking into the room here today, so we'll be taking a look at that in the next couple hours and be responding here through the balance of the day. Certainly understand that people want to know what's going on, and we'll be responding appropriately.
Okay, any other questions?
All right, well, thank you for joining us this afternoon, and again, congratulations to the newly expanded OSHN team. Look forward to working with everybody to create a safe and healthy city. Thank you.